Senator from Washington.
Thank you, Mr. President. Mr. President, last week we saw something amazing happening in communities across the country. When the news got out that the Susan G. Komen Foundation had cut off funding for breast cancer screenings at Planned Parenthood, men and women across this country were just outraged. They didn't understand the decision, they didn't agree with it, and they did something about it. They picked up their phones, they talked to their friends, they emailed, they tweeted, they called their elected officials, they made their voices loud and clear, and they got results. On Friday of last week, Komen did the right thing and announced they had reversed their initial decision, and I really want to commend them for that, because their mission and their great work in the fight against breast cancer is just too important to get mixed up in partisan politics. But, Mr. President, although that reversal was a great victory for so many women and men across the country, let's be clear, our fight for women's health care didn't end there. There are still many who continue to push partisan politics ahead of women's health, and we need to make sure that the grassroots support and energy that successfully came together to right that wrong last week continues to stand firm against each and every attack that comes our way. Because, Mr. President, we do know those attacks are coming. Republicans in the House of Representatives have been waging a war on women's health since the moment they came into power. After campaigning across the country a year and a half ago on a platform of jobs and the economy, the first 3 bills that they introduced were direct attacks on women's health in America. The very first one, H.R. 1, would have totally eliminated Title X funding for family planning and teen pregnancy prevention. It included an amendment that would have completely defunded Planned Parenthood and cut off support for the millions of women in this country who count on it. Another one of their opening rounds of bills would have permanently codified the Hyde Amendment and the D.C. abortion ban, and the original version of their bill didn't even include an exception for the health of the mother. And finally, they introduced a bill right away that would have rolled back every single one of the gains we made for women in the health care reform bill. Their bill would have removed the caps on out-of-pocket expenses that protect women from losing their homes or their life savings if they get sick. It would have ended the ban on lifetime limits on coverage. It would have allowed insurance companies to once again discriminate against women by charging them higher premiums or even denying women care because of the so-called pre-existing conditions like being pregnant. And, Mr. President, it would have rolled back the guarantee that insurance companies cover contraceptives, which will save the overwhelming majority of women who use them hundreds and hundreds of dollars a year. Now, we know that ensuring access to effective birth control is directly linked to declines in maternal and infant mortality, to reduced risk of ovarian cancer, better overall health outcomes for women, and far fewer unintended pregnancies and abortions, which is a goal that we all share. And, Mr. President, contraceptive coverage shouldn't be a controversial issue. It is supported by the vast majority of Americans who understand how important it is for women and families. And I also want to note that the affordable contraceptive policy we put in place preserves the freedoms of conscience and religion for every American. Churches and other religious institutions are exempt, and no doctor would ever have to dispense contraceptives if that's at odds with his or her religious views. But it also protects the rights of the millions of Americans who do use contraceptives, who believe that family planning is the right choice for them personally, and who don't deserve to have politics or an extreme minority's ideology prevent them from getting the coverage that they deserve. So I'm very glad, joining with all of my colleagues, that we beat back that effort by the House Republicans. And I truly want to commend President Obama for moving forward with this sound policy for women across America. Because, Mr. President, what this is really about, it's what it needs to be about, women and their health care needs. Not partisan politics, not point scoring. House Republicans and their allies have demonstrated they will stop at nothing to politicize this issue. Last year, they even threatened to shut down the federal government in a failed attempt to defund an organization that provides critical health services for millions of women in this country. And now they're trying to cut off contraceptive coverage for women across America. Well, they can keep trying to push their extreme agenda, but they should know we are going to fight back just as hard. Right here in the Senate, as we clearly saw this past week, with the voices of millions of people across America who feel very strongly that politics should never come between a woman and her health care. Men and women who will be watching what is happening here in D.C. and who I'm confident stand ready to act again. So I'm proud to be here with my colleagues today. I'm proud of the victory of last week, and I'm determined to remain vigilant and keep up the fight for women, for men, and their families. Thank you, Mr. President. I yield the floor.